violated us because you came here not understanding what we stood for. So you came into a group of people, and then now you feel ganged up on. How you gonna feel ganged up on when you joined a group of people?
You're right, but listen. What I want you, do you think that was my intention to come here? Obviously, it was a misunderstanding.
No, I told you why you came.
Okay.
You came here because you were Aries and you ain't
Exactly.
you ain't study all the details.
Yeah, I didn't study the details.
And Aries people be like, what? Okay, I'ma do it and I'll figure out the rest of it. Right? I don't got it.
I just want to do this shit. I just want to do this shit.
And then you ain't understand. You ain't understand the details of it.
Yeah.
And then now you see the details of it and you don't agree with it.
Yeah, but if you know that I'm not trying to be disrespectful. You know it wasn't intentional for me to be disrespectful.
Yeah.
You know it was a misunderstanding.
No, nobody ain't trying to disrespect you either.
But that's how I felt though. I didn't like
we
it.
feel like we could easily say you disrespecting us and everything we stand for.
But you know that it wasn't intentional. You know.
Listen, this ain't nothing but a paid reality show. And people who are young, who don't really have no responsibilities, or who could just walk away from their responsibilities anytime they want to, can just go out here and visit this place, have a good time or not, and leave and get their little 5 minutes of fame.
That wasn't
No. And I don't think anybody intends to disrespect you here.
Oh, okay.
You know what I'm saying? Yeah. So you
gonna be in a situation like where it has to be not once but twice, where it has to be me against everybody. That shit, like, I'm not feeling that shit, and nobody's gonna be feeling.
Or whatever they perceive to be as fame.
You
don't agree that a woman places at home.
No.
A homemaker. You don't believe a woman is a home, should be a homemaker. You don't believe that. That's her place. You don't believe a woman places at home.
I disagree. I think what you're saying.
Okay.
I feel what you're saying.
And she didn't know that they held those mindsets when she went there.
I think it's an oversimplification of a woman. I don't agree with that, and I knew. And this is what I said.
And so you said yourself that you don't like to cook. Did you or did you not say you don't like to cook?
I don't like to cook.
Okay, so in Babylon, when it was time to eat, what did you do?
Well, how is this relevant?
No, this is very relevant.
Okay.
Because we're talking about what a woman places. You said that you don't know how to cook, that you don't like to cook. You ain't your thing. You don't like to cook. And on top of that, in Babylon, when you was time to eat, what did you do? You ordered out. Uber Eats. That's how you lived.
Every time.
Okay, now you have no children. You have no children.
I have no children.
No husband.
No husband.
How are you supposed to protect and provide for you? How are you supposed to nurse and nurture your family? I'm talking about. You don't cook for yourself.
Listen.
You ain't gonna cook for your kids. You ain't gonna cook for your husband.
Listen.
So you're not gonna be a homemaker, and you don't think that a woman, her basic thing should be being a homemaker. You don't believe that.
What I don't believe is that a woman, every woman, and I'm not speaking for everybody, I'm saying that I don't believe that every woman should have to spend 99.99% of her time
being a homemaker.
Yes.
Wow.
Yeah.
Wow.
Yeah, I don't want to go.
Look at this nigga back, bro. Look at his face, bro.
I don't want to go into it again. I don't want to go into it. I'm trained. I'm talking about this again and again.
Okay. All right.
I don't want to go into it.
We don't have to go into it. So you don't feel like a woman should be a homemaker. Okay, we get it. We get it. Huh?
What if you flip the roles? Like, what do you think that a man is supposed to be?
I don't think Look, I'm not in the mood to get into a debate. It's not that I'm not.
The people want to know.
So she don't know how to have a conversation. It's too difficult. She don't want to talk about it, so she don't want to talk about it.
Look, I've been draining this shit. People, are y'all listening? I've been fucking having the same conversation multiple days. Hours on end.
Not hours on end. Calm down. You did not talk about nothing yesterday. Nothing. Wait. Stop. Because you lying now. Because you ain't say nothing. You went into isolation and took a whole day of rest. Today, we're simply asking you for a reason why you leaving.
And that I can get it.
Okay.
That I want to talk about.
Okay.
Getting into the woman's role. I'm not getting into it.
All right, so basically, so we got the reason. The reason is because you don't believe that a woman should be.
So that was my initial reason for leaving. Maybe I could have been talked down off of that.
Wait. Hold on. Wait, because now see.
No,
Wait. I'm gonna let you go. But I'm always gonna bring clarity. The devil is the author of the confusion. I'm always gonna bring clarity because I'm the opposite of that. So the clarity is this: you decided to leave because you couldn't agree or never be that woman that could be a homemaker.
Yeah.
That's
like, listen.
Did you understand what I'm saying?
I feel what you're saying.
Right, we're gonna go. I'm gonna let you go. But I just wanna get this clear.
Okay.
The reason why you said I can't fuck with this shit because I don't believe that a woman should be a homemaker.
The reason why I said that I want to leave and I don't fuck with this shit is because I don't want to do that. And I know I'm not going to do that. I know I'm never gonna be
a homemaker. You're never gonna be a homemaker.
No, listen, and I've said this multiple times. I'm willing to do what's necessary for the team.
So she thought she was gonna sit around and order Uber Eats out there with them. Okay.
Up in the kitchen, learning how to cook was vegan food was one of the reasons why I wanted to come here. It's not that I'm against cooking. What I'm against is the idea that I am forced into a particular role just because of my genitalia, just because of my anatomy. That's what I'm against. I don't believe that
a woman should be a homemaker.
I don't believe that every woman, and this is how I'm going to say it, and then I think we can leave it at that because I don't see what else needs to be said.
Right.
I don't think that every woman, every personality, every energy of woman needs to be spending 99.9% of her time
in the home.
In the home, in the kitchen, cleaning.
Okay.
That's what I'm saying.
Okay, where should she be? Where should she be?
I don't want this. I don't
just
want
relax, yo.
I'm
asking you a simple question. Now you under pressure. No, I'm asking.
I drill her too. I would drill her too because she came there and she been watching them like everybody else. She knew how they rocked and she knew that's what they was going to expect of her. Yeah, drill her.
Asking you where does she belong in?
Look, I'm trained.
Fuck it, it's over. Don't worry about it. It's over. Don't worry. I'm not gonna drain you no more. Don't worry about it. We ain't gonna talk no more. Go ahead, do your thing. Cause you starting to get out of hand. So just go ahead, do your thing. Yeah. You feel me? Yeah, be that. Y'all heard it. She don't feel like women should be homemakers. Meanwhile, that's what we're doing in our group. Niggas switch up new identities. I was just giving y'all what y'all wanted. I wasn't even gonna bother her. I was sitting here talking to the ladies right here. Y'all, you ask, yo, bring her down. See how y'all be instigating shit? You feel what I'm saying? You gonna try to say it's me. All I did was ask a simple question. Still whipping it up. Hey, we just want to let you know, women should be home. Maybe you know here, and that's how we live here in Carbonnation. So if you knew that, if you was watching us, you would know that. So why are you here? I did let her talk. She said she didn't want to talk. I was asking a question. She said she didn't want to talk. Point blank period. She leaving ASAP. Hit her up. Go give her donations. If you want to support that, let her come live with you. Let her come live with your ass. You know what I'm saying? Just, if we trade y'all one, y'all give us one, y'all get one. If she has a husband, she ain't gonna be able to cook for him or make a home for him. She's not gonna be able to do that.
Right.
So she has children, she's not gonna be able to feed them, be eating out. It is what it is. Fuck it. And if you have a man that don't know how to be a homemaker, why are you here? Sunny gonna have to jump too, or she gonna be on a flight with her. So y'all get y'all donations ready for Sunny and goddamn Umi. Cause if Sunny don't jump today, she gonna be with her. And I give you that. That's it. Point blank period. You don't like me?
Is he serious? Okay, I heard about this. Sunny is allegedly pregnant 4 months or so, and he wanted her to jump into this lake. They be diving off cliffs and stuff like that and jumping in the water, and something about she didn't want to jump because she's scared it'll hurt her baby. And he said if she didn't jump, she had to leave. So this is true.
Fuck you. You ain't gotta like me. You gotta like you. I told you already. Shout out to my haters in the building. Y'all go take Umi. Give us a woman that want to be a homemaker. Any woman want to be a homemaker, down with the knowledge, down with the squad. Y'all take Umi and shit. Send us one. We give y'all hugs. Fuck you. She gonna jump. She gonna have to jump. What's up, Sonny? What's up?
Yeah.
Come talk to the people. How you feeling about it today?
I feel good.
You feel good?
I don't get why she has to. I mean, she's young. That's her first child. She's scared. Maybe she has an instinct that's telling her it's not a good idea. What if something do happen? I mean, if you don't want to do something for fear that it might hurt your baby, you shouldn't have to. Period. That's just all it is.
I don't give a damn what y'all talking about. It's going down the way I say it's going down. And if you don't like it, oh well. You know what y'all do. It is what it is. You don't like it, oh well. Turn the channel. What's up?
Yeah, I feel good.
You gotta talk up.
I feel good. All I had to do was watch the holographic break because, you know what I'm saying, when you don't really into knowledge, it's going to take you off what this really was, like what this whole world was. And now that I know,
How does Spice feel about it?
feel like what? We jumping?
But by law, we can't do anyone over 40 in an outpatient center. Over 40, the risks of complications are too high, and those surgeries have to be done in a hospital.
Right.
I'm just reading the questions as they come up. Supa, if you've heard any other questions you think I need to answer, you always know, got your finger on the pulse. So,
Okay. Someone asked, okay, right here. I'm a pendant. Someone asked what kind of soup.
Why is she on camera looking like this? I mean, what's going on? She's talking about a surgery?
Okay, the name of it.
so she
So she's recovered from her memory and all this other kind of stuff?
had a full tummy tuck, right? She's had her kids. She lost a lot of weight, so she had a lot of extra skin. She's shown pictures of that. And so we did a full tummy tuck where we removed all the skin from the belly button down. We repaired her muscles, recreated a hole for her belly button, and then we combined that with liposuction of both the front and the back, including some sculpting of the buttocks as well.
Man, it's almost 4,000 people in here.
I personally do not do fat transfers. I know that's going to come up a lot. A lot of people want BBLs, and I let everyone make their own choices. I made a personal choice about 4 months ago to stop doing that procedure. We've just seen too many women losing their life from that operation. And it's not just at chop shops, in good doctors' hands too. My feeling is if an operation that you're doing to look better has such a high risk of dying, I don't want to be a part of it. I don't think that's right. And part of doing my job as a doctor is to keep my patients safe. And so I don't do BBLs. I think if it's something you really want, do your research, find someone that's very experienced. The other thing I think is really important is I don't ever combine other surgeries. When I was doing them, I never did any other surgeries with BBLs. I didn't do breast and I didn't do tummy tuck because I felt, one, it was too much surgery, and two, patients that are coming to me to get the best possible results they can ever get. If you do a breast lift and a BBL, how are you going to recover from that without compromising one of your results, right? If I do your breast first, then I have to lay you down on your beautiful brand new breast for an hour or two while I work on your butt. If I do your butt first, I got to lay you down on that brand new butt while all that fat moves around and dies while I work on your breast. So for me, it was never the right thing to combine those two together. See, someone's asking what is buttock sculpting. So that's what I have started doing instead of the BBL. And I honestly think a majority of the result you see in a BBL has to do with the sculpting that's done before the fat is added. So buttock sculpting is simply liposculpture, removing fat strategically around the buttocks. So you take it from the lower back, part of the hips, maybe even the upper thigh below the butt, and you kind of shape out the buttocks to create a shape and fullness without ever having to actually add something to it. The silly analogy I sometimes make is if you're at the beach and you want to build a sandcastle, you can either pile sand up high, which is going to be equivalent of adding the fat, or you can scoop out sand around it, which is going to create a mound in the center. And that's what we're doing with the liposculpting and the buttock sculpting. That is simply just shaping around to enhance the natural buttocks that somebody already has. Someone asked about ab
What happened to
sketching. No, I
squats
don't
and
think that's
leg lifts?
dangerous.
Oh my goodness.
I think sometimes it's sort of misadvertised, but all ab etching really is highlighting the shapes of the abdominal muscles with your liposuction. Mm-hmm. It looks great in pictures. The reality is what you're seeing is fat, not actual muscle. So you're just seeing the fat shaped like the abs. So in a still picture, it looks good, But when you move, it's going to move like fat. So I think better to do a really good liposuction, highlight the patient's natural muscle tone, and then you can work out and develop the abs. But certainly etching is safe. There's nothing dangerous about it at all.
Okay, right here.
Someone asked about a paniculectomy versus a tummy tuck. A paniculectomy is simply the removal of the hanging part of the belly. It typically does not involve liposuction, and it doesn't involve moving the belly button. It's more surgery designed for people that are so overweight that they're having problems with their skin, infections and skin breakdown under that lower hanging belly fat. So it's not as sort of artistic or as shaping of an operation as a tummy tuck is. Ideal weight range for lipo
Okay, so she handing out free Q&A with a doctor today. Okay.
360 is going to be the same as the tummy tuck. It's going to be, BMI under 35, ideally really under 32. What's most important is you want to be at your goal before.
I mean, my BMI is in the 20s, so I just eat right, work out. I'm just saying.
Your liposuction. The liposuction isn't going to get your weight down. Really.
Right.
It's going to shape you. And so you want to be at a point in your life where you're maintaining your weight, and then I can come in, remove whatever trouble spots are left, get that fat out, and get you the shape you want. Tomorrow is my day off, Princess Bella. I am so sorry. I got to spend a little time with the family, but I'm sure we can get you done as soon as possible. The belly button should heal similarly to the rest of the tummy tuck. I always divide healing into stages. The first stage is sort of the acute healing phase. That's that first week when you may have drains in, when you're sore. And then there's the sort of body healing phase afterwards. After a week, you're feeling good, but the tissue and the incisions and the scars, they still need time to get strength and to heal. And that takes about 6 weeks for that tissue to really get its strength back. Why is the death rate so high with fat transfers? I'll answer this quickly, and then I'd like to move on from fat transfers since it's not something that I do much, but I know it's very popular. When you are injecting fat into the buttocks, sometimes that fat can get inside a vein or an artery. If that happens, that fat becomes what we call an embolism. It travels through those veins or arteries and can wind up in the lung, the heart, or the brain and block off the blood flow to those areas. If that's a large enough piece and it blocks off a large enough area, you die instantly, right there on the table, and there's nothing you can do about it. The reason it's dangerous in the buttocks is there's very large veins in the buttocks, and when you're injecting fat under high pressure, it's easy to get it into those veins. So recently there was a recommendations that we changed and start injecting the fat under the skin instead of into the muscle because there's not as many veins there. It was a great thought, and it is a little bit safer. It's not as effective. The fat doesn't last as long. The shape isn't as nice. But unfortunately, we still saw people dying. And what we noticed at autopsy...
Listen, I'm not transferring no fat from nowhere. If you take some fat out of me, throw it away. Okay? Donate it. No, don't. Throw it away. You're not going to stick it nowhere. I don't... Build muscle. Firm up. Shape up. You got to do... God, wow.
Was even though the doctor thought and was trying to keep that fat under the skin, it was still getting into the muscle. That day was the day I stopped doing BBLs because once we realized that even when we thought we were doing it safely, we didn't have control. That's when I could no longer perform that surgery. When I was no longer able to 100% control where my fat was going, I couldn't put anyone at that level of risk. Someone asked about repairs to previous tummy tucks. If there were errors made during the surgery, or there are ways to sort of make the scars lower or thinner or improve shape, I'm always happy to evaluate you, and I do a lot of those types of procedures.
Altman because his scarring is amazing. His incisions are perfect. It's really seamless because of our black skin. Because we're African Americans, they do better jobs on us because our skin is different from others. And so then when I seen her work and she told me to go on this page and look, I went on this page and it was nice. I even asked my recovery nurse because she's so big on certain doctors. So when she coming back like 3 hours later, she was like, oh, this doctor is perfect. That's the person you can really go to. So that's why I chose that thought.
Thank you. Scarring. So scarring is a multifactorial process, and there's a patient side of it, there's a physician side of it, and there's an aftercare side of it. So there's three parts that determine scarring. Obviously, the surgeon side is the part I have the most control over. That has to do with delicate technique, how you handle the tissues, how you cut, how you sew. It's really important to treat that skin delicately when you're using it so you don't traumatize it while it's healing. Second factor is how you close your incisions. I don't skimp or cheap out on the type and amount of sutures I use. So a surgery like Supa, you may see some little sutures under the skin, but below that, what you don't see are hundreds and hundreds of sutures that I put in deeply to keep any tension off of that scar on the skin. I don't want the scar widening, so I keep a lot of that tension and strength of my incisions on the deeper tissues. And then the last part is the patient side. Some patients, everyone heals differently, and every once in a while there's going to be a keloid or a hypertrophic scar that happens even though you did everything the way you're supposed to, and there are ways to help treat that later. But certainly I recommend particular scar creams, typically silicone-based scar creams. I use scar tape, and the patient has to follow their post-op instructions. They have to listen when the doctor says, I don't want you doing exercise or doing too much activity or movement in those few weeks after the surgery when you're healing. So scars are tricky, but good technique, good surgeon, good patient following instructions, and a little bit of help from above combined, and you should have, everyone should be able to get good scars from surgery. Breast reductions, absolutely. I do lifts and breast reductions. I do not do labiaplasty, but I do have someone that I can, if people contact me, that I can recommend for it. We are thinking about adding some technology to our office and a specialist that will do some vaginal tightening and vaginal rejuvenation procedures. We'll certainly make an announcement when we do that. Payment options, any way you can think of, we can take it. We take cash, we take credit cards, we work with financing companies like Care Credit and Alpheon, and my office can also help you set up private payment plans directly to the office. Breast lifts, there are scars associated with breast lifts. I would say that I do more breast lifts with implants. Patients was scared about the scars before the surgery, and almost every single one of them will come to me afterwards and say they would take those scars any day to have the results that we were able to give them. So it's a trade-off, like anything else in life, right? There's a cost, whether that cost might be money, that cost might be scars, and that's a personal choice that I can't make for someone, but you have to decide, are these sagging boobs worse, or would a little line going down the center of the breast be worse, or would that make me feel better to get that shape and perkiness I want?
Small lines.
Small lines, fine lines, that's the goal, right? Tummy tuck after 3 C-sections, absolutely. I find that tummy tucks are a little easier in terms of recovery than C-sections. When you have a C-section, they're cutting through your muscles, they're cutting into your uterus. We're not doing any of that in the tummy tuck, so pain and recovery should be much easier. The issue with getting pregnant after a tummy tuck is we're tightening up those muscles and the skin, right? And the baby needs those muscles and skin to stretch. Now, I have had patients get pregnant after tummy tucks. God wins, right? He's able to, that baby grows and stretches out those muscles almost always. There is a fear that you could restrict the growth of the uterus, but I've never seen that happen. The issue then becomes, how do we fix it afterwards? And that's a little trickier because you tend to stretch out higher up in the belly where we can't repair it. So it's more of a cosmetic issue than a safety issue. But if you do get pregnant after tummy tuck, don't fear. Let your doctor know. Almost always the baby will absolutely be fine. Gaining fat after liposuction. All right. Here's one of my favorite analogies. When we remove fat, during liposuction. That is a permanent removal of fat. So think of it this way. Your body does not make new fat cells after puberty. What you got is what you got. And the analogy I use is think of those fat cells like balloons. When you get fatter, your body stuffs more fat into each one of those balloons. When you lose weight, it takes fat out of those balloons. But the number of balloons stay the same. The balloons just get bigger or smaller. When we do liposuction, we're taking out the balloons. So there is no longer a place for your body to store fat where we've done our liposuction. We can't get every single balloon out. So if you try hard enough, you'll gain some weight back in that area. But more commonly, what happens is you gain it in other areas. We see it in Miami all the time. Women are skinny all around their torso, and then they got big, heavy arms.
Yes.
Big, heavy something else, because they got their lipo, and they didn't listen to Marcella. They didn't change their diet. They didn't do their exercise. And so they kept gaining their weight, but they gained it in other places.
The legs and
arms. Sometimes you get lucky, you get it where you want it. Sometimes it goes to the booty, but typically it goes inside the belly where you get that sort of man-style, hard beer belly look, or it goes to the arms and other areas. Yes, almost all my patients can get back to a desk job after a week with a tummy tuck. Drains usually come out of the week, and at that point, patients are pretty comfortable sitting at their desk.
Okay, that's the one. There it goes.
Can lipo be done after an umbilical hernia? Yes. I'm not sure if you're meaning after you have a hernia or after you've had it repaired, but the answer is both. If you haven't had it repaired yet, you just need to make your surgeon aware of it, so he's very careful not to injure it during the surgery. Or if you've already had it repaired, then you can have liposuction as if nothing was ever a problem before. Some people are asking about health issues like diabetes. Having surgery is all about being healthy at that time. So if you have diabetes, but you're taking care of yourself and it's under control, your sugars are good, your hemoglobin A1C is good, then we can absolutely do your surgery. If you're not taking care of yourself and your sugars are high, you're not going to heal properly, you're going to be at more risk for infection, and we're going to have to wait until you get that under control. Cool sculpting. Cool sculpting is a fine procedure. It uses cold to actually freeze and kill the fat cells. I find it works best for small problematic areas. I don't offer it. I find liposuction to be much more effective, and when done properly, it's just as safe. But if for whatever reason you're uncomfortable with surgery, or you don't know a surgeon that can do the liposuction, cool sculpting is certainly an option. Tummy tuck versus lipo, we talked about a little bit already. I'll quickly review. Tummy tuck is going to remove fat, remove excess skin, and it is going to repair muscles. Liposuction is just going to remove fat. I do perform gynecomastia surgery. It's probably the second most common surgery I perform on men. The three things I see men for the most are liposuction, gynecomastia, and eyelid surgery. We're also starting to see men get a little more comfortable coming in for
this
their
is getting
Botox,
interesting.
etc. Smart lipo, I think should be called dumb lipo. The smartest thing about lipo is the guy who owns the company and the way the machine was marketed, because everybody knows about it, but any of us that have used it know that it doesn't really do anything. The idea behind smart lipo was you were supposed to pass a laser under the skin into the fat to help soften or melt the fat. When you were done with that, you still had to do your liposuction. So it was laser plus liposuction. The problem was that in order for the laser to be effective enough to actually melt that fat, it had to be so hot that it was causing injury to the skin as well. So what it wound up doing was really just wasting time. What happened now that I found is that most of the smart lipo machines have wound up in the hands of non-plastic surgeons. They're in the hands of dermatologists, family medicine doctors, because the plastic surgeons realized they really weren't working. So they started marketing the machine saying, oh, it's easier than liposuction. You can do it under local. It's liposuction. It's no different than liposuction.
Right.
So just what's most important about liposuction is not if it's smart lipo, not if it's vaser, not if it's laser, not if it's this or that, or whatever the other trend is. The most important thing with liposuction is who's doing it. If the surgeon is experienced, is safe, and knows what they're doing, you should be able to get a great result with any liposuction technique. Breast lift without implants is always an option. I think there's a big misconception there. My patients always tell me, well, my friend said if I don't get implant with my lift, then it won't last. And I think there's a difference between what patients think about sagging breasts and what I as a doctor think about sagging breasts. And here's the lowdown. A breast lift without an implant will last forever. It doesn't. The implant is only adding weight, making things sag more. But what it won't do is fill the top of the breast. So a lift treats the lower part of the breast. It brings the nipple back up to the center. It tightens the skin, and it lifts the sagging breast off of your ribs and off of your chest. But it's not going to fill you out of the top. If you're looking for cleavage and you're looking for fullness, that's what you need an implant for. If you're not comfortable with an implant, I have a technique called an auto-augmentation that I talk about. I didn't invent it, but I've modified it specifically for my practice. And in that procedure, I take your own breast tissue, the tissue we would normally remove during a breast reduction, and we move that to the top of the breast, attach it to the muscle, and use that to fill out the top. It doesn't give you as much fullness as an implant, but it gives you much more than a lift alone, and the most fullness you can get without an implant.
And this question is next. That's a great question for me because I always know this question about me having brachioplasty. So this next question is the really great question for me.
Cool. And the question is, can exercising tighten skin? No, it cannot. Once skin is stretched out, it is stretched out.
Yeah.
What exercising can do is it can build muscle mass so you can fill out that loose skin. But once skin has been stretched out significantly, it needs to be tightened either by removing it or by another skin tightening technique. Patients that have come to me will know anytime I do liposuction on the arm, I always do body tight at the same time. That is an invasive radio frequency treatment that helps tighten that tissue and improve the elasticity. So working out will not tighten loose skin, but it will help you build tone and fill out some loose skin. So it will help it look better. But if there's true skin hanging there, then you're going to need some sort of procedure to help tighten that up. Patients with...
One more question. Could you see if I haven't had a gastro or a bypass?
Can I see if you've had it?
Yeah, because they had a rumor going around that I had a gastro sleeve or a bypass. Could you see that Jimmy sometime?
So I didn't see any scars on your belly when I had my surgery, so I can't imagine how you could have something done without having a scar there, right? If you're going to have, even if it's laparoscopic, you're still going to have little tiny scars all over the belly and the belly button. I was pretty close to you for a couple hours, and I did not see any of that. So, and if there was a balloon or a band, I would have felt it as well. I did not.
Thank you.
Plus, we do a thorough surgical history, right? We have an interview and a consultation, and I can't imagine a patient would have surgery with me and lie to me or not tell me about a procedure they've had done before. It wouldn't make a lot of sense.
Exactly.
So, as far as I'm concerned, I did not see anything there.
Thank you.
Sickle cell disease, it all that I rely when patients have significant. We always get their doctors involved. So if you have a hematologist and he feels you're at a stage in your disease where it's safe for you to undergo surgery, then I'm more than happy to perform it for you. Of course, as a licensed physician here in Florida, I also have hospital privileges at the best hospitals in the area. So if there's any health risks, we can always do a surgery in the hospital as well. People are asking how to reach me and about consults in New York. I will post on my Instagram at Dr. Altman all the information you need to reach me. So when we're done here, you can always swing over there, and it'll have my office phone number. It'll have the dates I'm in New York as well as the phone numbers there, and you can always direct message me as well. Yes, I do brachioplasty. I have a special technique that I learned from a surgeon in France that has allowed me to do brachioplasties with really nice scarring, minimal complications. It definitely has more complications than other surgeries, but I'm happy to do it. My favorite example of brachioplasty was one of my former surgical techs who worked in our office for many years, lost a lot of weight. We did her arms in our office, and about 3 months later, she got married in a sleeveless dress, which she never ever would have been comfortable doing before. Was able to take pictures and not worry about scars, and have the arms she wanted for her wedding.
I should have handled you.
Lipo, cellulite has many causes. So some types of cellulite can often be improved with combination treatments of lipo and some sort of tissue tightening. Other types of cellulite can actually be made worse by lipo. So you have to be really careful of the areas. Typically, the thighs are a very tricky area to improve cellulite on, and I haven't seen a lot of good technology there.
I don't know what this one holds.
So, as we were talking about legs a little bit. So, yes, you can get lipo of the thighs. For me, it's very location specific. So, I'll treat the inner thighs. If you have a sort of a distinct bulge in the inner thigh, you're getting that rubbing and that irritation. We can treat that area. If you have what some people call saddlebag, or that bulge on the outer thigh or little areas around the knees, those can all be treated with liposuction, and usually with a combination of body type. I personally am not happy with the results I see for large liposuction of the legs. So I don't do full thighs because I think it leaves you with loose skin and cellulite, but I do small areas like that: inner thighs, outer thighs, and knees. People are asking for my Instagram.
It's right there.
Should be at the top, right?
It was not there anymore. It was changed it.
I'm pretty sure that's it.
Yeah, it was changed it.
How long do you have to wait after a breast augmentation to get an arm lift? So time in between surgery really is just about how you heal. Simple surgeries like a breast lift where there's not much blood loss, as soon as you're healed, you can typically go have another surgery, so about 6 weeks. Larger surgeries, 360 lipo, BBLs, you really want to wait till your hemoglobin and your anemia after that surgery has recovered. So that can also sometimes be as soon as 6 weeks. Sometimes it can be as long as 3 months.
You're right. It's a crazy question. I've been on for years.
Tummy tuck state. So look, all surgery has risks. Don't let anyone fool you, right? There's no such thing as completely risk-free surgery. So it's all about minimizing the risks. That's why we do preoperative workups to check your health, check your anemia levels, why you want to work with a board-certified surgeon in an accredited operating room. You want to make sure that the surgeon is the one performing the procedure, and you want to make sure that you're following your instructions, maintaining nutrition, not smoking, not taking drugs. But done right, complications from tummy tuck should be in the 1% range, or one in 100 or less. If you don't follow those instructions, if you have other health issues, you haven't been honest about your doctor, there's obviously more of a risk there. Someone's asking capsular contracture with breast augmentation. That is the sort of thorn in the side of the breast surgeon, because there is no complete control over capsular contracture. The best way to think about capsular contracture is it's like a keloid. When you put anything in your body, like a breast implant, your body heals around it with scar tissue. Normal scar tissue is soft, and we call it a capsule. Sometimes that scar tissue can get thick and squeeze that implant. And that's what's happening. When you have a capsular contracture, you have an implant, okay? Let me see if I can get this phone a little further away so you can see it. You have an implant, and your body is healing around it, and it's squeezing that implant tight. So it's causing that implant to feel hard and to push up. The best thing to do with capsular contractures is to not get them. And that's why if you have surgery with me, we follow a very rigid series of steps to help prevent the formation of capsular contracture. I always use silicone implants, much less capsular contracture rate than saline implants. I always put them behind the muscle. I always bathe my patient's skin twice with antibiotic solution, and I wash my implants as well as the pocket that I'm placing it in with a mixture of antibiotics and betadine. All those therapies combined have reduced my capsular contracture risk to less than 5%. Doesn't mean it doesn't happen, and when it does, we treat it. First, we treat it with medications, and if that doesn't work, we treat it with surgery. All the implants I use come with some form of warranty for capsular contracture to help or completely cover the cost of it if it were to happen.
One question from me: how can you get rid of cellulite on your legs? I've been having cellulite since I was a child. So how can I get rid of it? I know when I lost weight, I lost a lot, but is there any way I can get rid of it completely?
Supa, we figured that out. We're both going to be billionaires. But no.
I agree.
It's the most common question that I have to say I don't know to.
She just, Grand, you funny, bruh. I don't care about views. I'm doing this shit for my haters. This is my haters page, man. This is so I can have a relationship with y'all. I have to embrace my lower self. What's for Solano? What's for Solano? Empanadas? Ooh. Hold up, my rap just fell straight the fuck off. My whole rap just fell off. We about to go see what. Y'all see my chain? See my new chain? My whole rap.
Corny.
Having surgery with me, it's a risk, but a very small one that you should not worry about too significantly.
Right.
People keep asking about Cell Saver. I'll touch on that quickly. Cell Saver is a machine that processes the fluid or the fat that's been removed from the body, takes the blood cells out of it, and lets them go back into your body. Now, I don't use it because I don't need it. If you're doing the surgery right, your patient should not be losing that much blood that you have to worry about something like that. When you do liposuction, if you're patient and slow and you inject your tumescent fluid and wait for it to work, your patient should not lose very much blood at all during that surgery. If you're rushing, if you're aggressive, if you're taking out too much fat, if you have other people doing your liposuction for you, your patients are going to lose a lot more blood and you may need that Cell Saver. My personal feeling is that it's not something that should be required in elective surgery because the elective surgery should be done in a safe enough manner that you don't need it.
Now this question is dope because I haven't buried nipples. So can you answer that one?
Yes, absolutely, we can fix those. There's two things that I do for that, and it depends on what the cause is. If you can easily pop it out on your own, that's a pretty simple fix. If they're kind of stuck in and you can't pop them out of your own, that means you have little tiny ligaments that are holding that nipple in. Very similar to what causes the dimples and cellulite. And so what I do is we make a tiny little nick right at the bottom of the nipple. We cut through those fibers, and then I place a stitch on the inside to help keep the nipple projected. It's a great little procedure. It takes about 15-20 minutes, can be done with local anesthesia. You don't have to be asleep. We can just give you a little injection and numb up the area.
That was dope. So all these other questions should be answered when they pay you for your services. So you asked a lot of questions today, and I'm going to save the live. I'm also going to after I see it, I'm going to put it on YouTube if I can. Can I?
Great. Absolutely. Okay. You have my permission. Absolutely.
Okay.
When I talk honestly and openly.
Thank you. I'm open as well. So I will come see you for my 1 week post op.
You got it. You know how to reach me if you need anything before then. Stay safe. Stay healthy. We'll see you soon.
Thank you.
Okay.
Call me if you need anything.
Well, hey, that was dope. There was a lot of information in that. I learned a few things. Wow. Okay. Well, hey, like this video, share, and subscribe if you haven't already subscribed. Click that notification bell. Okay. Make that bell ring. And while you at it, make my Cash App ring. Peace.